promised you guys this segment. You're gonna get this segment. 5 minutes to talk about an important topic in Puerto Rico, and a topic that is so underrepresented, which is health disparities. So I've got some information here in front of me that I've been wanting to share for a long time around health disparities according to also to race. And I think a lot of people were very much on the same page when I was first talking about this. There was always like the one or two off like comments or DMs I get around like, stop dividing people by race. But we're not here about like dividing anyone. We're here about educating on like the realities of the lived experiences of Black people in Puerto Rico, as well as in the diaspora, because it's very clear that there's a lack of understanding around the intersections of all of the isms. So with that being said, this is part of, my hope and my attempt to like talk about these issues from a place that's not abstract, from a place that is very grounded in the stories that we hear and in the data that's available. Because as someone with a public health background, I wanna mention that this isn't just one story here and there. This isn't someone who's just like complaining for the fun of it or for the attention. This is real. And so based on all the data and the studies that have been done across the world, because racism isn't based in one place, it is everywhere. And it can affect anyone, even if you are someone who is afrodescendiente, even if you're Black. Like racism and internalized racism affects us all in many ways. So I want to first talk about Puerto Rico and the landscape that exists here. Many people have talked about the lack of healthcare. Many people have talked about hospital closures, but I just want to like contextualize it and also keep this conversation going, because 1 hour segment every few months, I feel like it's good. It's good to bring attention, but it's also important to keep this conversation going so people who might be available to step in and work together and organize together. I'm not saying come in and save anybody, right? Because like diaspora has to be very aware that like communities are working here on these issues. So it's not like you're coming in and helping to save something. It's more like, where can we identify how to provide support and amplify work of people here? So I hope that's clear. We'll keep talking about that. But I want to start with the basics. I have something here in front of me I'm reading, because obviously there's a lot of information to keep in my tiny brain. So let's talk through all of this piece by piece. Right. So the health system sits at the intersection of colonial funding limits, environmental danger, and economic instability. These are not small things. These are all interconnected. And across the island, hospitals are closing. They're operating with skeleton crews. Many towns haven't even had an OB/GYN in years. Forget about mental health. That's another aspect that is really lacking. There's wait times for surgeries, mental health services, MRIs, and that can stretch for months. I know people who have literally decided, this is not feasible for me. This doesn't work for like my condition. I need to leave in order to get care, right? And so that's something that I think a lot of us, as we discuss the issues in Puerto Rico, and the differences between like a Puerto Rican that's raised out versus in, like we have to realize just the level of lack of resources and the exploitation that has happened here in our communities for years, that of course someone like me who was like raised out there is not meant to know. We're meant to sort of like, be proud of our culture, and that's about it. Like not learning about the deep history of repression, of violence against anybody who was saying this is wrong, who speaks against colonialism and demands that Puerto Ricans have their own autonomy and their own nation. Like I will always say, like, Puerto Rico should be a nation. This is not difficult for international communities to understand, right? There's a lot of people in international circles who are like, yes, of course Puerto Rico should be free and independent. But then there are Puerto Ricans both in the island and in the diaspora who still have a question about whether or not we should be independent and free. I don't want to go into that because I will just get really angry. So let's just focus. Let's keep moving here on the health disparities in Puerto Rico to sort of like get people to continue to, wake up and understand that this is more than just a question about political status. This is a question about exploitation and how our communities have been lied to and pushed into these circumstances that are just unacceptable and just absolutely, to me, it's disgusting that we even have to like prove the point to anyone. Anyways, let's move on. So we have to add the environmental layer as well here. So when Puerto Rico, when we look at the toxic sites compared to the US, we have the highest concentration of toxic sites. Coal ash in the south, contaminated groundwater in the north, environmental exposures that are shaping the health of entire generations. And this is known. This is not, I'm not like revealing anything. This is known. This has been communicated by many organizers and activists. I just want to highlight that. And then hurricanes, earthquakes, thousands of people's homes have been filled with mold because of these hurricanes and earthquakes, and respiratory illness is persistent, and like I said, this isn't the pattern. This is just the outcome of underfunding, austerity because of an unelected fiscal control board that gets millions of dollars to keep delaying the process. They keep getting paid. They don't mind that this process keeps going. They legitimately, it's like when just to contextualize it for the working class, right? Because we are the working class. They're the ones at the top oppressing us. But let's contextualize it. It's like, you go in for a shift and you're supposed to work till 10, but you stay a couple hours later. For them, it's been years. They're supposed to solve the problem of the Puerto Rican debt that was created by them. This is created by the, just making sure that this is still working. Created by the Fiscal Control Board. Created by, sorry, I'm so angry that I can't think straight. It was created, right, by the Puerto Rican government, by Wall Street, by vulture funds, by investors, by a system, and people always say, like, let's not bring down Obama, like, he was so good. So, luckily enough, people are now aware that, like, Obama's just part of the same system. It's like, come on now. So, in any case, the Fiscal Control Board is part of their methods, right, of like displacing Puerto Ricans by bringing in this unelected control board to just like manage the funds, and all it's led to is closure of schools and hospitals. Like if you're going to like try to fix the economy and pay off a debt, wouldn't you try to like spark the economy a little bit? Wouldn't you try to find ways for the economy, for people within to like build and like be able to like raise enough in taxes? No, instead you find ways to close schools and hospitals so that people leave. It's not rocket science, guys. Environmental neglect, right? We've talked about this. But I want to focus in for a minute on women and how Puerto Rican women face higher rates of chronic disease like diabetes, hypertension, maternal health outcomes that are worse than in many states. Access to prenatal and postpartum care varies drastically depending on where you live, because of course, if you're a wealthy Puerto Rican, you can manage that aspect of it. I don't know, and I look at this and I just say, I get so frustrated because Puerto Rican women were tested on without their consent, without their knowledge, for the birth control pill. And people don't know that. And yet here we are, discussing how even with having done this incredible service to the world, right? Like being guinea pigs for trials that end up benefiting all women all over the globe, where with a pill that is sometimes life-saving for some women, and yet here we're facing some of the highest rates of chronic disease. And so I just want to like hone in on that, like I want people to understand that here there's this, C-section rates are the highest in the world. They're driven by hospital staffing issues and not patient preference, right? Like this is driven by like doctors being told like this is what we're doing, rather than like the health of the women. I knew I was gonna need to like really breathe through this because this is so outrageous. Reproductive health options are limited. Maternal mental health services are stretched thin. And gender-based violence just adds another layer, because seeking care for trauma or after trauma isn't simple, especially when clinics close early, transportation is limited, providers aren't trauma informed, some of them. So to understand women's health in Puerto Rico, you have to understand the social, economic, and environmental pressures that are wrapped around it. And again, it's very hard not to get angry, and it's very hard not to get frustrated by this, because I've heard these stories from women here. You know, like, I think that those of us in the diaspora who actually connect to the real lived experiences of people here have heard these stories. We don't find them, we're not surprised by them. We're not like, that can't be right, you know? So anytime someone comes in my comments and is like, you're trying to start something, you're trying to like divide people, you're trying to like exaggerate, I'm just like, either sometimes it's mostly men. Yeah, mostly men. It's, yeah, we're here still in this crap. But it's, you know, those people I just block, because it's like, I don't need you here. But I also want to say that, like, it's frustrating when I get those comments, because it's like, we're not here to try to convince the people that don't want to listen. We're just here to like inform. So I'm here to motivate people to connect with this, right? And to not shy away from what's uncomfortable, and say like, where from my experience can I help, or where can I find ways to like get involved in some way to help. And it's literally anything that you think about that you can do, and be creative and just connect with people here. I think like one of the things that was mentioned in my last episode, I think it was Subi who said like, even small things make an impact. Like, even if you do one thing, it makes an impact. And if we can do that across the board, across like millions of people, you know, 2/3 of Puerto Ricans being outside of the island, if even each one of those makes like one small impact, and I'm not saying like charity wise, I'm saying like, be involved, care, like take time to be invested, right? And not just like, oh, I'm in and out, not just like, let me take a trip in and out. I understand people are busy, and I understand like also the pressures of like living within the freaking empire and dealing with all the, but it's like we have to stop that whole like, I'm here for a second and then I'm gone, and like, good luck with that. So, you know, again, this is not trying to point fingers at anybody. It's just more like, think about this, think about like where we are with that. And then I just want to end with this piece, which is, you know, we've talked about racism recently, and a lot of people were sort of like not really grasping or connecting, but the majority were. So I want to say like, thanks for those who like you got it. you weren't like denying that racism in Puerto Rico is a thing, that there's a difference in health disparities for Black women, Black Puerto Rican women especially. And, you know, we could say that across the U.S., it's very clear that Black women experience worse maternal health outcomes, higher hypertension, more chronic stress. But in Puerto Rico, it's amplified by colorism, anti-Black discrimination, and the environmental neglect historically around Black coastal barrios, like Loíza, for example. And so when we think about this, you know, anti-Blackness is a common term used in the U.S., and people are like, well, it's not the same, it's not said the same way here, it doesn't move the same way here. Absolutely, it is different. But right, when we talk about like the ways racism gets hidden, in that sense, it's important now, right, to highlight that it's a real thing. And how is it a real thing? Where is it a real thing? Maternal health, you know, I was recently following a doula who's Afro-Boricua here, and, you know, she said that there's just not enough data here around Black women's health. And I believe her. Like, I did, you know, that just the minimal research I did to try to just at least like get some information together. It's clear. A lot of people talk about the lack of access to data in general, and obviously the Puerto Rican governor is about to probably sign away the rights of, you know, violate the constitutional rights of Puerto Ricans by signing this law that limits transparency. Yeah, of course she is. But so when it comes to like healthcare and health for Black women, right? Like focusing in on this, and you know, a lot of Black women, when they speak up here and they're told that it's nothing, or they're told that you're exaggerating, it can become dangerous, because when it comes to health, obviously it's about prevention. So getting to things before they become a huge problem. And so we have to talk about how that's a piece of like the cultural racial aspect of it. It's like it's the dismissiveness of women's experiences in general, and especially Black women. And then environmental injustice obviously plays a role in terms of the exposure, the higher exposure in general to flooding, coastal erosion, contaminated lands, and infrastructure decay. I think about Vieques a lot too. I think about Culebra. I think about the higher rates, you know, there's higher rates of asthma, skin issues, stress-related conditions. And again, I wish this could be a shorter, you know, reel to kind of like talk through, you know, quickly, but it's so important for us to stay and be engaged, even, you know, going into like really spending time with these things. So I'm glad that you're here and glad you've listened to this video. You know, I want to just say that like these effects, you know, it creates an effect that, you know, chronic exposure to racism, it's literally wearing people down. You know, it's accelerating aging and disease risk, and you know, it's not like a genetic issue. It's an issue of structural racism. It's preventable, and it really does demand our attention. So you know, thank you all for spending the time to like hear this out and talk about this. You know, put your comments in the put your comments below and talk about, you know, if any piece of this really connected with you, and help us engage with this and like share this out with people, because too often it gets ignored, dismissed, and we have so much, you know, to do, you know, in terms of like breaking through that thinking of just like dismissing something. So I appreciate those people who are obviously like always down to like, let's talk through this. Let's be clear about the racism. Let's be clear about the health disparities in Puerto Rico, and acknowledge that our people are being exploited by the U.S. government, and that these bases and what it's going to represent for future generations is not good. It's not a small thing, and it's not something that's going to be beneficial in the long run. It hasn't been to date. You know, you walk around or you drive around Puerto Rico and you could see it. It's like weird that anybody would say that, like, thank goodness the PNP is here. Anyway, what do these health disparities tell us? They tell us that our communities aren't unhealthy. They're being underserved. They tell us that our outcomes aren't random. They're a product of systems. And it reminds us that we have to fight for health justice, same way we fight for environmental safety, reproductive freedom, racial equity, and invest in our people. So if we want better health, we need better systems. We want better systems. We need truth. We need courage. We need community power. And so thank you for listening. You know, if this episode resonated, just share it. You know, there's ways you can support. I'll put that in my caption, but I just hope that we can keep building together. So thanks again. I'll see you in the next one.